Thanks, and thanks for having me here today. Really excited about this topic because I do believe that we are really now at a tipping point in oncology and oncology care, and I think that the application of informatics in this space is playing a role, an increasingly important role, that is going to help us take steps today, right? We've been hearing about data in oncology for years. We've been hearing that, we'll put all this data together, we'll learn from it, we'll learn how to better treat patients, and there's something to that, but tends to be a longer timescale horizon, right? If we're gonna build up databases and try to learn from patients, which we're doing, a lot of pharma companies are active in this space, a lot of device companies are active in this space, and we are making breakthroughs along those fronts. But I also feel there's a thing we could do today, and we're starting to do today, that's really making a difference in patient care and outcomes. And as we get going on this, one of the things, I joined Philips about a little over 6 years ago, and we started talking about customers being more engaged in their healthcare, and that trend has only increased, right? And so we're talking about it still. It's new. People looking at Google before they go see their doctors. This continues to accelerate, and customers are now engaged not just in doing research ahead of time, but in terms of cancer, thinking about things like screening and how they get engaged with whether it's the increase in number of low-dose CTs that are given for lung cancer screening, or advances that we're making in prostate cancer screening beyond just say PSA tests. So customers are getting more and more engaged in their care, and are getting engaged in it when you think about the cancer journey, since cancer is the number 2 killer after cardiovascular disease. They're getting engaged early on in terms of prevention, in terms of healthy living, but then increasingly when they get through diagnosis or into treatment and then into home care. And patients are now also living a lot longer with cancer than they were in the past. And that's a lot due to early detection, and it's also due to some breakthrough therapies that we've been able to treat patients with. So consumers are again much more tied in here. And to make this real, and this is kind of how we think about it, is that across these different areas, whether it's early detection or precision diagnosis, or how we select the right treatment for patients, how these treatments are carried out, and then how they're followed up, each one of these little decision points has become an opportunity to bring together information around that patient, around a specific clinical question, and then augment that information with additional content. That content, I'll give you some examples of this, that content can come in the form of expert guidance, that content can come in the form of artificial intelligence, that content can come in the form of just being able to model the disease better for a decision, right? So as an example of this, and some of the things that we're doing at Philips and we're doing in partnership with AWS, is in prostate cancer care and diagnosis. Being able to look at radiology and pathology results together, but in a way that articulates it around a disease. There's actually a discordance in findings between radiology and pathology results in prostate that lead to incorrect staging of the cancer. And we've published on this. And if you get the staging slightly wrong, if you get the diagnosis slightly wrong, you're going to get the treatment slightly wrong. The diagnosis is the input to the treatment. So we believe that by getting that diagnosis right and trying to improve the precision around this, by whether it's pulling radiology or pathology data together, whether it's pulling that information together with genomics data to make a better informed decision around diagnosis, is going to lead to the better therapy. Now, when we start thinking about the therapy choices, again, there's been an explosion in the cancer space in terms of the number of therapies that are available to doctors. We hear increasingly from our clinical partners that they can't even keep up. If you're a community oncologist, keeping up just with the number of new therapies that are approved, the number of new indications that are approved, has just become an intractable problem for them. So what can we do around that decision making? So now I've got my patient, I know they've got a diagnosis of cancer, I know the stage of disease, how do I want to treat them? There are choices between targeted therapy and immuno-oncology, standard chemotherapy agents. Some of these drugs carry significant side effects. So if my patient maybe has a cardiac comorbidity, it might steer me in one direction or another. Or if my patient has concerns around side effects like neuropathy, it may steer me in one direction or another. How can we then augment that decision-making process today to drive decisions? And we believe by doing this, that we're all familiar with the quadruple M in healthcare, but as a patient, if I know I'm getting a better right diagnosis and put on a right treatment path, I'm going to have a better health outcome. I know this, right? Also, there's going to be a lower cost of care to the system because we're not putting patients on therapies that are inappropriate for them, right? Or putting them on a therapy that causes an adverse event in another area of their care. So these are the things that we're trying to do here by pulling this information together. And the only way to really do this at scale is to do this on the back of a platform, and this is why we've partnered together with Amazon and AWS in order to deliver this. So what does this look like? And I know this is a healthcare technology audience. Sometimes I give a talk to an oncology group and I have to explain all the boxes. So hopefully this group understands what these things mean. But at the foundational fabric layer, we have Amazon Web Services and a layer we call Philips Health Suite. Philips Health Suite provides the high trust security, HIPAA, the ability to exchange data across networks. So that's just at a sort of fabric layer. And then as we build up from this into this kind of system of engagement, and then configured applications on top of that can then be further customized last mile to individual health systems. You know, unlike Microsoft Teams or WebEx or Zoom, I don't know what networks you guys use, every time I connect, it feels like the buttons move around. Doctors don't like that, right? So how do we work with an always on, always updatable web environment that provides that last mile to the clinician that gives us control over it and what they experience. So we've done that. We've done that again in partnership with our friends here at AWS. We've then been able to configure these applications to deal with really tough problems, like finding incidental lung nodules in a radiology report and then tagging those patients for follow-up, driving a lung cancer screening program. These are in the sort of early detection space. I mentioned in the diagnosis space, the radiology, pathology, genomics kind of correlation, discorrelation. It's a real issue, right? There are patients, or breast cancer patients who come in and they have an immunohistochemistry test that's equivocal for a HER2, which is a marker for a certain drug. Though they get reflex to a cytogenetic test for that same marker, and they'll get maybe a next generation sequencing panel for that same marker. And unsurprisingly, there are cases where those three things don't add up. And the docs have to make a decision. Well, so what we're trying to do is, we're not trying to make the decision for them, but we're trying to surface that information to them so they can make an informed, do I retest this patient? Do we go forward with another kind of therapy? So, and in a treatment space, you know, again, we do a lot of these things in partnerships. Let me just talk about that last point, right? So I talked about pulling data together around clinical decision making and how we could then augment that information. And so what I mean by augment that information are things like this. So we have a partnership with the Dana-Farber Cancer Institute around therapy guidance, expert guidance in cancer care. Now, why do we do this in partnership? Well, you can't really look backwards at data and predict what the right therapy is for a patient for one key reason, which is that every 2 months there's a new therapy on the market. So if I have like the world's best predictor looking at data that's 2 years old, would you want to be? I wouldn't want to be treated with that, right? So you have to have, in some cases, you need expert guidance. So we have teams of clinicians that work together with us to adjudicate the evidence, to look at the latest FDA trials, to look at the recommendations, to look also at the data and how docs have been using the platform. I gave the example earlier of neuropathy, and it was actually, this is a true story, where they, on their initial expert guidance, they had a certain class of drugs which had a side effect of neuropathy, and they learned from the data that some of their patients weren't being put on it because they were concerned about it. So they augmented the pathway to say, well, if you're worried about neuropathy, then here's another choice for you. In breast cancer, they found a lot of women were not being put on the recommended therapy because they were concerned about hair loss. So again, the docs at the Farber said, okay, well, if that's a concern, if you're concerned about alopecia, then we have an alternative therapy choice, which would also be considered a best practice. So this is both learning from data and expert guidance sort of coming together. Now, there are also cases where you could look at data historically. If that front end isn't changing so fast, you can look at historical data and learn from it and build AI models. And we work with some partners on thinking about predicting malignancy of lung nodules, right? So there are groups that are doing this based on radiomics data. They've established enough evidence. There's actually some of these AI methods are now even FDA approved, and we can incorporate that information to help guide decision. Now, why is this important? Well, the guidance around lung nodules leaves about 40 to 50% of them in this indeterminate state, where it's unclear whether or not you should biopsy them or just follow up. So if we can provide a little bit of extra information to say, okay, well, yeah, you're in this middle ground, but the model saying your patient's is progressing toward malignancy. So maybe think about a biopsy, or and your patient's not. So maybe think about come back in 6 months for a CT. And this is what I mean by how do we augment those decisions with content. So whether it's expert-guided content or AI models, and in the case of a care management, it's another case where we're using algorithms to kind of predict, patient flow across the network. So we can use these things also on the operational side to drive pathways. And the last thing here, and I'll just sort of summarize it, which is that if you spend all the time to think about how you're going to deal with these clinical decisions, and you've modeled the decision point, in the background you're also modeling the disease. And you're modeling in the disease in a way that the EMR systems typically don't capture, right? So a lot of this data is in the EMRs, but it's not in an easily accessible way. I call it EMR archaeology. If you really want to learn from it, you've got to go through all the patient notes, and you've got to hire teams of people to figure out what's going on. So we're certainly not structuring all of that data, but in the cases where we're driving some of these clinical decision points, we are actually modeling the disease in a way that no one really has. And that lets health systems learn, right? So we're not trying to, again, tell them what to do, but just statistically, you can say, okay, well, what kind of patients, in my lung clinic had a navigated bronchoscopy, which ones had a transthoracic needle, which ones then, following that procedure, maybe suffered from a pneumothorax, and which patients should go A or B. And then, okay, well, what was the diagnostic yield from those procedures, right? Because you want to make sure you can get a definitive diagnosis after you do a biopsy. So by being able to capture this data and present it back to the docs, and to their own care teams, they can then, in real time, adapt how they're treating their patients. They use the exact same thing I mentioned in the earlier discussion around pathways. Just looking at what kind of providers are treating what kind of patients across their network. And maybe they have some experts in some rare cancer types that they want to funnel patients to. They can track to make sure that's actually happening. So the connection between, I think, the clinical analytics and the operational analytics is also starting to come together. So again, this would not be possible if we built this in like a standard on-premise stack somewhere. You can see how you'd be disconnected. You really wouldn't be able to, in real time. Those Dana-Farber pathways I mentioned are updated north of 100 times per year across the different diseases. You'd never be able to roll that out if it were an on-premise in the data center kind of solution. And you certainly wouldn't be able to provide this sort of analytics, which can also now cut across institutions. Philips takes no right or ownership of any of this data, but we do let our customers share data with each other, and are doing this. Saying, okay, well, because we've got, especially in cancer care, sometimes those ends, the number of people in those populations is really, really small. And so we can pool data together and learn together. And they can do this on the back end again. This is only possible if we did this in a cloud-enabled way. So with that, I'm gonna end here, take any questions that you might have. But thank you all for the time, and appreciate AWS for inviting me here to speak today.